Mm.
Welcome back. Welcome back to Living in Mexico. I'm Ana Maria Salazar. Thank you. Thank you so much for joining us. I want to take a pause for a moment and talk about other issues that are not directly related to the tariff catastrophe that we're living around the world due to Donald Trump's decision this week to impose tariffs on all exports that literally all exports that enter the United States. There's more than 60 countries that have now that Trump has imposed tariffs on. So I'm going to put a pause on that. I'm even going to put a pause on talking about the security situation in Mexico. I want to talk about something else, and we haven't spoken about this in a while. But as you know, those of you who've been joining us throughout the last 20 years, it's health issues are have always been very important for this show, Living in Mexico. And this week, there was an interesting something important happened. Something interesting happened. The Mexican government issued a press release stating that a baby, a 3-year-old baby, has been identified with H5N1 influenza. It's avian flu. And the question is, um, how worried should we be? What does this mean? As you know, I follow these issues very, very closely because in addition, we also have measles outbreak in Mexico, and at least in some parts of Mexico City, I know there's whooping cough. So I mean, it's always a good idea just to kind of check in with Dr. Pablo Kuri so he can give us an update as to how worried we should be, what we should we do, Pablo. Welcome to the show. Let's talk about this press release
Thank you,
by
Ana.
the Mexican government. What could you put into context how worried we should be?
Yes, for sure. Thank you, and hello to everybody that's hearing us. I mean, this is a press release that was issued by the Ministry of Health of Mexico, and it talks about the first case in 2025 of H5N1, which is avian influenza, as you mentioned. It's in a child, as you also mentioned, of 3 years of age. The problem is that she is in a bad condition currently, and we don't know what's going to happen to her. Unfortunately, in this release and in the information that it's available at this point in time, we don't know how she got infected. It is quite probable that she got infected through through some kind of either birds or some kind of poultry, which is the basic source of this type of influenza. But we don't have that information. I would say that at this actual point in time, we shall not be worried too much about what's going on. We should be aware of what's going on and what might happen, but we should not be really worried a lot of any possibility of this going worse or getting worse. But I mean, we should be expectant. We should take into consideration any kind of information that we can have in the future around these cases. But at this point, we don't have to be more concerned than we were yesterday. Just it's the first case. It's something to make us aware that it's going on. And well, we have to take into consideration that there's always a possibility if and only if there's transmission between humans, which has not happened yet, or at least not reported, that we might have a major problem. But at this moment, let's be aware, let's be cautious about what we say and what we hear.
Hmm.
For example, in the United States, we have in this year 70 cases of H5, most of them, 41 of those 70 cases related to cattle,
Hmm.
24 related to poultry,
Hmm.
two to other animals, and three of unknown exposure. but none of them human-to-human transmission. So until we continue to be in that situation, I might say that the risk of having a major problem is low, but is not negligible.
But it's good to hear you say that, Doctor. I mean, I have to remind our audience that you are one of the worldwide experts on pandemic and very well known international epidemiologist. And it's good to hear you say that, in part because we have been following very closely these outbreaks of mainly flu or of this avian flu in cattle in the United States, in other mammals in the United States, and of course in poultry. And as we had been reporting until very recently, the impact this influenza was having in the United States, which had increase dramatically the price of eggs. I mean, there is already an impact we have to talk about, and of course, the U.S. government has taken steps to try to control the price of eggs, in part because it has an enormous link to inflation in the United States. So, I mean, there has been reporting, there's a lot of conversation out there, but I also think, Pablo, it's important to remind our audience, we've been talking about a pandemic avian flu, for 20 years now, something like that. I mean, there's been concern since it started appearing, since it started appearing, we could see cases in Asia. The world started to prepare for the eventuality of an avian flu pandemic.
You're completely right, Ana Maria. I mean, just a reminder. I mean, we were prepared when the H1N1
Right?
came in 2009. We were expecting actually an H5N1 pandemic because there were a lot of cases, not a lot, but several thousands of cases in human beings in Asia, basically, of H5N1. None of them transmitted human to human. All of them transmitted from animals to humans. But what we prepared for in the pandemic preparation, there were several groups, and let us remind the North American Pandemic Preparedness Plan, and there were lots of, we once said that there were a pandemic of pandemic meetings because there were lots of meetings throughout the world preparing for that.
Right.
And actually, we got the H5N1, which was, I would say, mild. I mean, not what we expected. So we have to be ready. The clock is ticking, and we might get a new pandemic, but we don't know when, actually. But well, I mean, these new cases reminds us that this has not gone, and it's not gone, and will not go, and we will have a new pandemic. When? Unfortunately, we don't know.
We don't know. Let me ask you this. Just following up on what's happening with the measles outbreak in Mexico, which is, I guess, somehow linked to the measles outbreak in the United States, which has also been making news for different reasons, in part because, this anti-vax position that appears to be taken by some government officials, but also, it's an outbreak of a disease that could be very dangerous especially for babies and pregnant women. I mean, how are we doing in Mexico? And what is going on in the United States? Can you give us an update?
Yeah, well, yes. First, I'll start with the United States because the outbreak really started there. There are three outbreaks. They have reported as of, I think it was the 1st of April, a couple of days or so before we were talking, 607 cases confirmed in the United States in 22 jurisdictions or states. The worst outbreak or the worst concentration of cases is in Texas.
Yeah.
And I can tell you that the worst number of cases in Mexico is in Chihuahua. So it's near from us. So actually, we don't know what's going on. I mean, how it's going to evolve, we actually don't know. It's something that's very important, and statistics that's very important. of the 607 cases in the US, 97% were either unvaccinated or they don't know their vaccination status.
That is.
So I think I'm aware of what some of the officials in the US say about vaccines, and there's a movement of anti-vaccine movement in the United States. It's not new, but I mean the evidence shows that vaccines are far more better than not using them in terms of the risk of this type of diseases. And in Mexico, we don't have the problem of anti-vaccines as in the US, but we have had problems with the coverage in the last few years with some of the vaccines due
Yeah.
to things related to policy and not getting the vaccines
Resources.
and resources. Yes.
Yeah.
So, well, in Mexico, there are around 80 cases, most of them in Chihuahua, a few of them in Oaxaca. And I guess that there are more cases that might not have yet been
Mm.
detected, but well, there's always a risk when your vaccination coverages go down,
Yeah.
and that's what's happened in the last years in Mexico. Now, the new government in Mexico, the one that took office in October, has retaken the strategy of what we call the National Health Weeks or National Vaccination Weeks. And they're going
Mm-hmm.
to start, as far as officially they've stated, the
Mm-hmm.
Minister of Health just stated a few days ago, they
Mm-hmm.
will start by the end of the month of April, maybe in May, and they will have 3 weeks per year, which was what had been done in the last 15 years or so, and was
Mm-hmm.
forgotten in the last administration. But now
Mm-hmm.
they're retaking that strategy, which will help to increase vaccination coverage, not only for measles, but for you
Mm-hmm.
said completely right. Whooping cough is another problem that we have in Mexico. It has never been
Dengue.
eradicated, but now we
Mm-hmm.
have more cases than what we used to have, for example, last year. And those are all vaccine preventable diseases.
Mm-hmm.
So,
So, I would like, you know what I wanted to ask you, because when you were Deputy Secretary of Health, and in other positions, international positions, I imagine that the coordination with the U.S. government, which HHS, CDC, all these agencies in the United States that have the responsibility of health and well-being of Americans. I imagine that coordination was very close, particularly in certain areas, especially in the eventuality of a pandemic crisis. I'm just thinking of one example, but I mean, do you have what's your opinion of what's happening in terms of these massive firing of experts and doctors and scientists from HHS? How I'm just trying to think the impact not only in the United States, but I imagine there's going to be an impact in other parts of the world. I'm thinking about Mexico. If there is no one to coordinate with in the United States,
you're
Dr.
completely right, Ana Maria. I mean, the decisions have been taken and they are being implemented.
Hmm.
They're going to fire thousands of people from HHS. And of course, it will have an impact on what we call global health, for
Right.
sure, because the participation of U.S. personnel experts from the health institutions
Hmm.
of the United States, as you mentioned, HHS,
Hmm.
NIH, CDC, and other institutions um, has been very important for
Hmm.
several countries, especially for those that don't have the resources, the skills, and the personnel also that has a good
Hmm.
preparation, which have been really supported in the response for emergencies, health emergencies, by people from this type of institutions such as the CDC.
Hmm.
So for sure, I cannot anticipate how much it will impact, but it will have an impact, and it will have an impact for what we call global health security, global health possibility of responding to a health crisis in the future, regardless of where it starts. It might start in Asia, or it might start in Africa, or in the Americas, or even in Europe. And always teams that are composed and basically from people from many places, but in many cases from people from the US might not have that human resource to respond to this type of threats and risks that might occur in the future. So
You know,
it's going to have an impact. We
yeah.
cannot really measure how much, but I'm sure it will have an impact in global health.
You know, it's interesting because, we've been focusing so much this week on tariffs and the impact on tariffs on the Mexican economy. But, there's other aspects, other decisions that Donald Trump is making that perhaps we haven't really analyzed or evaluate the impact this could have on not only in the bilateral relationship and matters that has to do with health and vaccines and preparation for a future pandemic crisis. But it also, affects Mexico. So it's always interesting to talk to you. One last question. I really, really appreciate you joining us today. Where, as there was this massive restructuring of alliances of the United States around the world. Do we have any sense, what's going to happen with the leadership of the world, for example, the World Health Organization, which apparently Donald Trump has stated that the United States is going to step away, is no longer going to be a member, is no longer going to provide resources. Where is that leadership going to lay now? In Europe, China? I mean, I'm just trying to get a sense where, who is going to try to step in and exercise some type of leadership when we have, like you said, it's not a matter if it's going to happen or not, it's when we have the next pandemic crisis.
I think that the possibility, which is I don't know if it's going to become real because they have a lag time between the announcement and actually leaving the
Mm-hmm.
WHO of around a year.
Mm-hmm.
But if the US leaves the WHO, the World Health Organization, let me just remind the people that are hearing us that the US is one of the most important supporters in terms of funding of the WHO. It's not only the technical and the people that are not going to be working with WHO, but it's also the funding of the operations of WHO,
Mm-hmm.
which it has many problems and can do better, but in any case, it's our multilateral and global organism that is in charge of looking after the health of people throughout the world. And
Mm-hmm.
not having this financial support and the technical support, of course, will have consequences. And you're asking who's going to step in? Well, it's a difficult question, but of course, Europeans and some countries from Asia, Japan, and maybe China. Although
Mm-hmm.
China has not been really, I mean, we all know what happened with SARS in 2003 and what happened with the scientists that discovered COVID-19. So I don't know if it's going to be the best to think about China really stepping in. But
Mm-hmm.
I guess at this moment in time, due to the resources and the technical capabilities, it has to be the European Union or European countries that
Mm-hmm.
have to take this leadership role.
Mm-hmm.
And I don't think at the end of the day that they can just leave and forget the rest of the world because in the US, because there are no boundaries and there are there's not another boundary for diseases.
Right.
So it's difficult to isolate yourself and say, well, we don't want to see what's going on in the rest of the world. We don't want to help the rest of the world because at the end of the day, it will come to you.
Right. Right.
So
Well, it's always great to talk to you. I really appreciate you joining us here once again on Living in Mexico, Dr. Pablo Kuri. You know him well. He's been joining us throughout the years. I think in the last 15 years. You've been on this show. I think since the almost the very beginning when we started broadcasting Living in Mexico. Yeah, like 20 years ago. So I
yeah.
really appreciate you joining us, Dr. Pablo Kuri. He's an expert epidemiologist and public health expert. Thank you so much for joining us.
Thank you and have a nice day.
Thank you. We're going to go to a break. I'm Ana Maria Salazar. Thank you. Thank you so much for joining us here on Living in Mexico. We'll be back.